actually the first of a series of 3 different events that we're going to be doing this year. So and they're all just going to kind of roll into each other. So we hope that you really enjoy this. We want everyone just to feel really relaxed and comfortable, and just hopefully the candles and the chocolate and all the beverages are helping us kind of, just unwind before Valentine's Day. But we have some special guests with us this evening, and tonight we're very excited to just kind of offer this opportunity to talk about some different issues. We have Dr. Georgine Nanos, which she's not only the owner of Kind here, which is an amazing practice. She also has over 18 years experience as a primary care physician, specializing in women's health. So in my opinion, there's, not much more of an expert that there could be. And really her goal in this practice, and I think just her career in general, has always been to empower and help women. And that's just something that I know I'm so grateful for. I think anyone that knows her just gets that from her right away. And so we're just very grateful that she has Kind, but then also that we're all part of this. So Dr. Georgine Nanos is here. And then we also have Julieann Myers, who is the founder of the Center for Healthy Change. She's also you do a lot of things.
I know.
So I picked a few. Okay. She's a licensed clinical social worker. She's also a sex therapist. She specializes in working with relationship and intimacy issues. And I'm sure there's a lot more things that might come out throughout that, but we're very excited to have her here kind of contributing to the conversation this evening. And then we have April DeMaggio, who is our physician assistant here at Kind. She's our aesthetics PA primarily here in Kind, but she also does all of our Mona Lisa procedures, which there'll be a little bit of conversation around that this evening as well. And she also has over 19 years experience in primary care, and her focus is also in women's health. So just a lot of great knowledge and experience. And then we also have Debbie here, who later in the evening will be giving just a really sweet and beautiful, amazing testimonial. So just kind of welcoming everyone here. Also to kind of let you know, you probably noticed this little setup here. So we are filming just this part of the room this evening, and we are, recording obviously the audio on their behalf. So that's kind of why we have the setup like this. So just wanted everyone to know, don't worry about the camera. Chloe over here is our beautiful marketing specialist, and she's going to make sure that all the focus is over on distraction. So just wanted to kind of calm anyone if they were worried about that.
And I think the questions are going to flow through Chloe,
yes.
So there won't be any voice recognition happening at all.
Yeah, exactly. No facial recognition. Absolutely. And then also, you all have received a note card upon arriving, and you may or may not have filled out any questions. If you don't have a note card, Maisie is actually going to pass those around, and you can feel free to ask questions. If you have them now, that's great. We'll kind of do a collection of them in about 10 to 15 minutes. If you don't have one then and you have one later, that's great too. We'll kind of do a post, a recap on our Instagram of kind of different questions, and we'll continue to answer those throughout. So if you don't come up with one, if you don't come up with one right away, that's totally fine. But we will be asking those, and then there is also a questionnaire that Julieann has provided. That is completely yours. It's yours to keep. It's completely private. And then, of course, if there is anything afterwards that you want to discuss, we have information, and everyone's available for you all. So welcome. And I will kind of hand it over.
Okay. So as a female physician, as Angie was saying, it's really important for me to hear the women that I come in contact with every day, not just as friends, but as patients and colleagues. And I think, we are better when we're stronger, we're better and stronger when we're together and we can share our experiences and really grow from each other. And this is why having events like this are really important to me. And one of the reasons we're actually filming this is because, this is just one room, but we can, spread this message to other women as well who can't be here tonight. And that's also important to me, to kind of help everyone as much as we can. So, we're going to, this is kind of an informal format. We're going to talk a little bit about some questions I think that we already have. I think Chloe was going to maybe read a couple of them. And then, Julieann, did you want to lead off with anything before that?
Do you want to hear a funny story?
I love that.
Yes. I love this story because when I started getting trained as a sex therapist, we have to go to this annual conferences, and it's really crazy. It's like getting a brand new degree. It takes years, and it's very intense. The first one that I went to was about 5 days in Monterey, and what they have you do is something called a sexual attitude reassessment. And for 2 or 3 days, you are basically inundated with every single kind of sexual behavior, preference, gender, kink, everything. And I'm sitting there going, oh my God, this is really intense. And it's a circle of people. We would watch movies and have dialogue, and then we would have this processing circle, and it would be physicians and psychiatrists and therapists and educators, and everybody would go around the circle and say how they felt after they saw something. And it went around, and it got to me, and I was like, I'm nauseous. And everybody's like, okay, now we don't have to be politically correct. But at any rate, this conference is quite intense. So for about 5 days, I didn't talk to my husband. I was just going to all the breakout sessions, and I'm completely overwhelmed. And then he picks me up at the airport. And he said, how was the conference? And I said, oh my God, I learned things I didn't even know about. And I was like really overwhelmed. And he got the most afraid look on his face. He's like, oh my gosh, what has happened? He goes, you're not going to be one of those crazy sex therapists, are you? and at first I was defensive. I'm like, okay, of all the trainings I've done, I'm not crazy yet. And then it occurred to me that he was freaking out because all of a sudden I had more knowledge and I had been more exposed to things sexually, that then he was going to feel insecure. And so I, for a moment, had a little compassion, and I thought, oh my gosh, so he's really triggered. He's thinking that this is going to be a bad thing for us. And so instead of staying in my defense mode, I thought, okay, I'm going to have a little fun with this. And so I said, yeah, like this polyamory thing, honey. I'm like, I never even considered that. And there were these really great looking guys there. And I said, they're going to meet us at our house. And then he started laughing, but it just really...
Like a really nervous laugh.
Yeah. And then we got home, it was all cold, no one was there. But it really is interesting how sexuality can bring up such insecurities or fear, or we don't talk about it, and it's something that I've become really excited to actually treat, because I can kind of talk with people and women that don't normally talk about it. And even in therapy, often people will come in, and if I bring up sex, they'll be really uncomfortable at first, and then they're completely relieved. They're like, thank you so much. And so I think it's a really important topic, and it's central to all of us. It's the most tender, intimate part of ourselves, really. And especially as we start to get older, then there's other issues that come up. But generally, even from the time that our very first awareness of sexuality all the way through our lifespan, it's just really something that I feel passionate about helping people, delve into. So thanks for listening to my funny story.
It is so true that women get very nervous talking about it at first, but then once you kind of create a space where they feel safe and can share, everything comes out, which is awesome.
Yeah.
So we want that to be to happen tonight. So with that, Chloe, are there any good questions we can start off with?
Yeah. So if you follow us on Instagram. Today I posted asking ladies what questions do you have regarding sexual health, and we got 3 people who asked questions. So the first question is, how do you not let personal issues affect the relationship and sex? So like personal issues that happen, how do you not let that affect like your sexual relationship?
So I'm going to take a stab at what personal issues are. I'm assuming that might have to do with self-esteem or insecurity. One of the things that I think is true is that personal issues or emotional issues do affect sexuality. And we have a perfectly designed system in our body that we don't function very well if we're dysregulated or if we're emotionally upset or we don't feel connected to our partner as women. And so it is going to affect your relationship, and that's where I think communication is so important. And if we're not communicating with ourselves first of all of what's happening inside of our bodies, or if we're upset or if we're holding back our feelings, then that's going to come out in your intimacy and in sex. And it should. Because if it doesn't, then we're disconnected from our bodies.
Yeah, that's so true. And I tell a lot of my patients who are having intimacy issues, the first thing we talk about is their emotional health and their mental health, and addressing that is really important because women's arousal system is so different from men's. It's so multifactorial. There's so many things that go into us being aroused. Where with men, it's just very linear. It's like yes, on, off. But we're not like that. There's a million things going on, and even if you don't have personal issues, it just may be the issues of the day, like, you're running through your grocery list and like what you got to do next. And so, or kids. And, so that's fairly common. But I think, to your point, addressing a lot of underlying emotional issues is really important as well. Did you have anything you want to add, April?
Well, I think, what you said, that it is really true. We as women, we really prioritize our sexual needs very differently. We got to get everything done, the dishes done. If we're angry that evening, we have to get over that first before we're even thinking about, loosening up and being ready for any intimate contact. And you're right, men, they don't care. They could argue with us that moment, and then if we offer them any intimacy, they'll just turn around and take it, and that's so shocking to me. Like, I don't understand. I could be angry for days, but as far as like how do we get over that, the question, that's very difficult. I know I have not figured that out. That's a good question. And I would think, honestly, like talking to someone like you is really the best tool that we could have in our tool belt, is to really delve into, getting over those issues and finding ways to prioritize that in our lives instead of putting it way down there,
Yeah, and I think that what can happen is women will come in and talk about intimacy issues or relationship issues, and the goal is really for each person to learn how to have the confidence and know how to speak about it in a way that their partner can hear it. And one of the things that is an inhibitor for men is when women get frustrated and start speaking to their partners like children, or get naggy, or like, you should know what I think or feel, and we've been together for a long time, why don't you know what I like? And then all of a sudden men are feeling unsuccessful and put down, and so it actually causes them, or partners, it causes the partner to not want to keep trying because they don't feel successful. And so I'm thinking also about another story where I was at a conference, and this relationship expert was talking about how she had been in the spa before the conference, and there were two girls in the sauna, and they were talking about how their boyfriends wanted them to give them a blowjob. And the girls, the way that they were talking about it is, I just told him I'm not going down on him unless he does it on me, and blah, 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 blah. And the relationship expert said, that finally she just got sick of hearing it. And she said, girls, I just have to tell you, this is what I focus on. And it's sort of like she was schooling them in the sense that saying, if you want your partner to do something for you that you enjoy, scolding them isn't the way to do it, or putting them down isn't the way to do it. And so it's really about helping people learn how to communicate in a way that you're going to get what you want, instead of actually creating the effect opposite of what you want. And a lot of it honestly has to do with communication and feeling comfortable enough inside yourself to know what it is that you want, and then being able to say that.
Yeah, that's the tough part.
Okay, yeah. So how do we communicate best our needs and desires while still validating our partners?
That's all you.
Wait, can you say that one more time?
Yeah. How do we communicate best our needs and desires while still validating our partners?
Okay, so I'm thinking of one lead-off statement that might be helpful, and that is, I really want you to enjoy sex, and I really want to enjoy it also. So please do more of this, or when you do that, it feels really good. That is a way to validate somebody, to encourage them, but also let your partner know that you're willing to also please them and give them what they need and want. Is that a simple answer?
So our next question is, what's the connection between hormonal imbalance and painful intercourse?
It's all you.
Right back. Sure. So as women age, as we get older into our 40s and 50s, we have estrogen and progesterone going through our bodies. And as we approach perimenopause in our later 40s and 50s, that estrogen supply starts to dwindle and diminish. And so as that happens, the estrogen is what provides lubrication and collagen and elastin to the vaginal tissue. And when there's less estrogen in our bodies as we age, that collagen and elastin and the lubrication within the tissue starts to also diminish. And so when you're feeling drier and it's harder to get lubricated and get aroused, that in turn creates a painful situation for some women. So that's the actual medical reason. Did I explain it okay?
That was perfect, yeah.
The tricky part is what to do about that.
Yes, so there are lots of options that we can talk about. You want me to go into those? Sure. So there are several options for managing those symptoms. The first is just over-the-counter lubrication, KY jelly, Astroglide. Those are great products that you can use at the time of intercourse with your partners. They're a little messy, and not everyone gets relief from them alone. The next step would be talking to your doctor about hormone replacement therapy, either systemically or vaginally. So you can take estrogen and put it inside the vagina, and that's probably a safer option than if you were to take it orally. Even though there's lots of hormonal solutions out there that people take orally, I think it's important to mention that you've probably heard a lot about bioidentical hormones versus regular hormones, prescribed hormones, plant-based hormones. They all are estrogen, and so they're all going to carry some very, very small risk, particularly as you get into your later 50s and 60s, if you're taking them orally, of slightly increasing your risk for breast cancer and heart attack and stroke and blood clots. And so that's fine for some women if you're willing to assume that risk. But and you just have to be aware of that. So even if you see hormones labeled as bioidentical, they're still going to have that estrogen supply in there that could potentially cause harm to you, especially if you have a family history or a personal history of breast cancer. Those may not be safe for everyone. That being said, they are a great solution for a lot of women as long as you have that conversation with your doctor and you make an informed decision that's best for you. So if your friend tells you like, oh my God, I got these hormones and I got them from Mexico and they're amazing, that may not be your best choice because your body chemistry and your history and your medical history they're unique to you. So it's important to really have an informed discussion with your doctor and not get, bioidentical hormones from Mexico. Or Amazon, thank you, yes. Or like wherever people are getting them these days. I can't ever keep up. And then, so that is a very good solution for a lot of women. And then, as I was saying, vaginal estrogen is inserted in the vagina 2 times a week, usually 2 or 3 times a week. And that's also a very good solution. And what happens with vaginal estrogen, because it's just local to the tissue there, you're not really absorbing it systemically if you're not administering it more than 3 times a week. So that's considered a safe option if you can't take oral estrogen replacement or oral hormone replacement. So a lot of women find that to be very useful as well. So for the women that can't tolerate hormones, or if they've had a personal history of breast cancer in the past and there's just no way they can take it, another option that we have here in our office, we have a couple of different devices, but primarily we have a laser called the Mona Lisa laser, and it's a laser that delivers light energy to the interior walls of the vagina and creates little micro perforations in the vaginal wall tissue, the tissues of the vaginal wall, and what that does is stimulate new elastin and collagen and blood supply to the tissue and creates new lubrication. And that's a very simple office procedure that we do here. It just takes 5 minutes. It's totally painless, and we do it 3 times 6 weeks apart. So that's pretty effective. And then you want to talk about Emcella or anything else that I missed? I feel like I'm talking nonstop.
Well, the Emcella is great for some incontinence issues that we can experience when our estrogen is also depleting. We can have a couple different forms of incontinence. So just, we call it stress incontinence, but when we perform that Valsalva maneuver, when we cough, laugh, or sneeze, dance, run, that kind of stuff, when we leak a little bit of urine, that can be helped with the Mona Lisa as well as with the Emcella device. And then there's other types of incontinence too, which we can experience at the same time or just even by itself, and that's when we feel that urge to urinate, when our bladder fills to a certain volume and we lose a little bit more volume than just that little leakage amount. So the Emcella is a great new addition that we have here at Kind, and usually people will get anywhere from 6 to 10, but an average of 6 to 8 treatments, and you will come once to twice a week, and that really helps to build the pelvic floor muscles back that have kind of created laxity in our pelvic area there. And it's like doing, what is it, Jackie, 11,000 Kegel exercises to the best of our ability. And a lot of women, we're just not able to do those Kegel muscles correctly. And if anyone has had any issues with incontinence and you come to see us, the first thing that we tell you to do is to, practice those Kegels, do those Kegel muscles, and then you come back inevitably and we say, well, how did that go? And you say, well, that didn't really help. And what we've really found is that patients weren't really successful at knowing how to do them, or they'd forget to do them correctly or on time. And so we would send someone, to teach them how to do that. And this is just a device that does those just perfect, really powerful Kegel contractions for you. Yeah, Angie.
Just because, I feel like we always hear this term Kegels.
Yeah.
What exactly, we know we're supposed to do them as women, but, why? And, what exactly are they, and what do they help with?
Well, it helps. It's a contraction, and it helps to kind of strengthen that muscle. If you think about, this is how I kind of describe it, and you can probably help me
I'm
here.
dying to hear
But
this.
like when you're in that urinary stream and you kind of close that off, you think someone's going to open the door or something, and that muscle that you are stopping that stream, that is the muscle that you would kind of isolate and try to strengthen when you're doing a Kegel muscles. That kind of
That's
like how
exactly
you would
it. Yep.
describe it, but unfortunately, that is very minor if you were to just do what I told you to do. Really, what you and what a physical therapist told me has to be done is you have to start there, but then you have to kind of pull that all the way up to your belly button, and that's what's so difficult
And hold it.
to manage. Yes.
Yeah.
Yeah, to get it to be successful and to make a real difference, and that's why we're just not that successful. Yes, yes, Jackie. Yeah, I know, right? And that's what you should do all day long.
Earlier on the machine is like you can be driving and thinking you're doing your Kegels, and then you get to like 10 and you're like, I can't concentrate on Kegels now. I have to drive.
Yeah.
So
Yeah.
The good thing with that machine as well is it's bringing all that blood flow too. Just
Mhm.
like,
Yes.
not exactly the same, but it's just like working out when you get all pumped up and all your blood flows to your muscles. So it's really good for that health wise because it's stimulating more activity. there,
Absolutely.
and it's going to do more to help you naturally kind of get excited and then more lubricated. So.
To your vaginal tissue.
Is it painful?
Yeah, because I hope
No.
I'm doing
No.
Kegels for more than just like not peeing my pants. Like,
Yeah. Yeah.
so yeah,
Your
it
vaginal
helps other
tissue.
issues too, yeah.
Yeah.
She asked if it was painful. I sometimes describe it as having like the sensation of pop rocks in your vagina. So it's not painful. It's different, but I don't think it's painful at all.
Yeah.
It's a little roller coaster of
Yeah.
fun. Some people get really aroused on the machine itself, so it's not that bad.
It's an unusual feeling.
It is an
It
odd
really is.
feeling. But yeah, that's a good explanation. And I think something that you say all the time is so many muscles in our body need to be exercised, and your pelvic floor muscles are like any other muscle. They need to be exercised and maintained to kind of stay in their best physical condition, and so that's one way to help do that.
Yeah.
Good question.
Yeah. I'm going to switch gears a little bit with a different question, but this one says, I feel like I have more man energy when it comes to sex. Am I weird?
Well, man energy. So what I'm assuming is that means, yeah, it's a little bit of a judgment, but I'm assuming that probably means that maybe their desire for sex is more than their partner, or that maybe they have a high libido, and we tend to have gender or sex stereotypes about what's female and what's male, but different people can have different sex drives and different interests, and there isn't anything weird about that. It's just different.
I think getting back to your earlier point, it's communication with your partner and communicating what's important to you and how you feel, and that can change at different times in your life, from hormonal changes to environmental changes, social changes. So you have to recognize that what was good for you at 20 may not be good at 30 or 40 or 50 or 60, and kind of be in tune with that and expressing that with your partner.
And it changes over the lifespan too. Often, if you're with somebody that's about the same age as you, and you get to menopause, have you noticed all the negative words with men in it? Menopause, menstruation, mental illness. Sorry.
I never noticed that.
Sorry.
Meningitis. Wow.
I'm sorry. I'm just playing.
That's a good one.
I'm just playing. That's really bad. I'm just teasing. But over the lifespan, so you get to menopause, and women tend to lose estrogen. They're more in touch with testosterone. Plus, at that time in life, you're kind of done raising kids. You've had all this estrogen, the nesting hormone, and then that starts to decrease, and often what we'll see is women start to be more self-assertive and be more interested in what's left for me and what do I want to do, and sometimes even their sex drive will increase. And then what happens with men, similar in age, is that they start losing testosterone. They're more in touch with estrogen, and so then they want to nest, and they're like, honey, I'm home, and the wife is like, and I'm out. and it's like this cosmic joke in that time of life. And so often people will be like, what happened here? Because it was so different in the beginning, right?
Yeah. It's a great point.
And honestly, that's another thing. So we have the stereotypes of older men like younger women, but if we're only looking at that from sort of like the interest in relationship quality, younger women want stability, and aside from men liking hot young bodies, they also really like having somebody that attends to them. And so vice versa, which we tend to judge older women with younger men. Younger men are more independent, more autonomous. They're not as interested in being taken care of necessarily. And so older women are well suited for younger men. I mean, that's kind of interesting in that way, right?
Yeah.
A fun fact.
It's good to know.
Yeah.
Does sex get better with age?
I think it can. I think one of the positive things about being postmenopausal is you don't have to worry about getting pregnant anymore.
Right.
Yes.
A lot of people say that too.
And
Yes.
really, that there's a freedom in that, and you're more comfortable with your body. Hopefully, you're not as concerned about competing with, fake book or those kinds of things, and so you're more comfortable, and hopefully you're more assertive, and you have more knowledge about yourself and what you want. So
I agree.
I agree too.
would you? Anyone else agree with that? That it gets better?
That actually, it kind of like, not that question specifically, but I've always admired Debbie's just story, because what I have always admired is the openness that you had in your relationship to actually discuss like some of the things that were going on, because I think like for me personally, I know I've always had, it's hard for me to sometimes express some of that, and so I kind of like think we could maybe lead into like your testimonial, because I think that just that communication that you and your husband have had is so beautiful and amazing.
Scoot on the couch so we can make sure we pick up
Join
the party story.
So what happened was, well, I'm 7 years older than my husband, so I'm not sure what that means. But after menopause, I had the atrophy. I had urinary incontinence. I got a lot of infections, urinary tract infections. Whatever the symptoms were for the Morley, I had all 5 of them. So, and I started with just going to the doctor and saying, I have painful intercourse. I don't want my husband anywhere near me. This is just, it's not fun. Every time we have sex, I get a urinary tract infection. I have to go on antibiotics. Like, it's just not worth it. And then it put, like, a relationship got distant because he'd want to have sex, and I didn't want him anywhere near me. So I started with the Premarin creams and the Vagifems and all the estrogen. But the thing is you have to do it like 3 times a week. Even when you're not having sex, you're still putting, like, it's goopy and it's messy and it's not comfortable. So I didn't like that. And then my OBGYN sent me to a compound pharmacy to do the DHEA, like one day testosterone, the next day. And still, it's just too much to think about. Like, my kids are still, they were in high school. So it was just like, I'm still being the mom and too much to think about. So I had the fortunate pleasure of meeting Dr. Nanos, who was just starting with the Mona Lisa Touch and was one of her first patients.
I think you may have been the first.
Actually. It was in 2017, and I had talked to my gynecologist about it to see, is this something I should be thinking? And they didn't know enough about, like she said, I can't tell you yes, I can't tell you no. I just don't know enough about it. If you do it, let me know, kind of thing. So I did, and so the first treatment, and it's just what Dr. Nanos said, it's you come in, it's takes longer to get the numbing cream to take effect. So you're just listening to music, you have numbing cream, and she comes in and we chat for 5 minutes and you're done. And it's painless, and about an hour afterwards, as I was running errands, picking up the kids from school, doing whatever, and I'm driving home, and it's like, it's getting a little warm. Like after the numbing cream wears off, it's like, oh, it's getting a little warm down there. But that's it. Like it's not painful. It just was, you just put on Aquaphor and go about your business. There's a zero downtime. So 6 weeks later, you come back and do it again. 6 weeks later, come back and do it. And my relationship with my husband improved dramatically. There was no more infections, and there was no painful sex, and it was just an amazing experience. And so that was 3 years ago. And then 18 months later, I came back for my maintenance treatment, which is just one. Like you just come back and get another jolt. And then I've had 2 more maintenance treatments since, and it's amazing. I'm 65, so I think since my husband's younger, I still have a little bit of sex life left.
A lot. You have a lot.
And I've done the M-cell chair, but only twice because it was when it was here on demo. So I was supposed to come for my treatment. They're like, don't come today, the chair's gone. But it is amazing. I'm going to come back and do the full treatment because it's...
Oh, and tell them what you told me about the gynecologist.
What?
The office.
Oh, so the gynecologist, I just saw her yesterday for my annual checkup, and I said, remember when I talked to you about the Mona Lisa? And she's like, yeah. And I said, you couldn't tell me, like, should I do it or shouldn't I? And so she said, yeah, I just didn't know enough. She goes, but we have one in our office now. So they're doing it. And it worked. And she said her patients, same thing. Like, it works. I don't know what it does, but it works. Yeah. It made a huge difference in my relationship with my husband because I did not want him anywhere near me.
Yeah, he and Jeff is pretty funny. He tells a similar story.
He tells it from the men's perspective. Because he was here once, and there was the same room full of women, and he was like, okay, it doesn't matter. Whatever it costs, just tell your husbands. It's worth it. They'll thank you for it. Yeah.
That's funny.
It will save your marriage. No, it was good.
Thank you, Debbie.
Oh, you're welcome. I'll move back to my chair.
No, you're fine. You can stay here with us. Stay. Sit here. We want you in the...
Okay.
Well, this is a question about the Mona Lisa laser, and I know you kind of talked about how it was painless, but how does the Mona Lisa laser compare to a facial laser, mild like a fractional or more like a CO2?
So the Mona Lisa is a CO2 laser. It's the strongest laser out there. If you were to do it on your face, it would be the same as an ablative laser. Because we're doing it in the vagina, it feels differently than it does on your face. You have different nerve endings there. We also use a numbing cream externally, so you're not going to feel anything. It is literally painless. So, I mean, I haven't had anybody ever complain of any pain during the treatment. Have you? I don't think that's been an issue for anyone. But it is an extremely powerful laser, so that's what allows us to get those really dramatic effects pretty quickly.
And another question we have is orgasm, fake it till you make it.
Well, it would be good if you didn't have to fake it till you make it. Yeah. So both of so there's a lot of options there that I know a lot of my patients have talked about with regard to what's on the market for improving orgasms. what I always say is, working on your relationship and your self-confidence, and, getting to a state of arousal, like, for, as I said in the beginning, for women is really different. And so being present and doing things, communicating to your partner in a way that is communicating what's pleasurable to you is probably paramount. All that being said, it's still difficult for some women, and so there are some options out there. I think there's some pills that have been marketed that have never been FDA approved. There's a couple out there, but their efficacy is pretty low. And some women have asked me about the O-shot. The O-shot is it's a PRP, it's platelet-rich plasma, so you draw your blood, it gets spun out, and then it gets injected into the clitoris, which is very painful.
That sounds painful.
And there isn't a lot of scientific evidence behind that in terms of its success rate. So it's kind of mixed results. There isn't a lot of data to really support that. But there are some people around that swear by it, so that's something that people can look at. Our laser and our Emcella device, the Mona Lisa laser does help improve orgasms as well as everything else that it does, but the Emcella is a much stronger device for that. So that has FDA clearance and backing, and a lot of clinical studies that have shown improved orgasm that are backed by actual science. So in terms of what you're looking at, you want to look at something that's actually been studied in a scientifically rigorous way, and that it has results behind it. So the Emcella would be the best choice for that if you needed help with that, and that just creates a lot of blood flow stimulation to the area and just makes it easier for women. And again, like 6 to 10 treatments, depends on kind of where you are, tends to be effective for that.
And the treatments are 28 minutes?
28 minutes, yeah.
What is an average amount of sex with married partners for over 50?
Oh,
That's a loaded question.
Do you want a man to answer that or a woman?
I'll give you that one.
Yeah. Let's go to the experts.
Well, average is relative, and it's contextual, and it also depends on what you're talking about with sex. Is it intercourse or is it sex? I mean, and many couples over 50 have sex without as much intercourse.
So how are you making that distinction? What are you defining as sex versus intercourse for people who might be wondering?
Well, so sex could be anything, oral stimulation. It could be petting. It could be anything that is not intercourse, that's still sexual in nature. Some people continue to have sex 3 or 4 times a week over 50s. It just really depends. Some people have sex once a month, and I don't know that there's really a normal. It's sort of something that couples come up with, hopefully, that works for both of them. So that there isn't really a normal. I think anything to an extreme is considered not in the norm.
Yeah, I would agree. I've been asked that question a lot, and that's usually the answer I give. It's something you come to an agreement with your partner, hopefully, and there really is no normal. It's a wide range of normal.
I think that's where, like, we kind of get this pressure from society. So we kind of had these, like, movies playing that we all identified with, and, there's, like, lingerie scattered, and I think, like, socially, those are things that are fed to us that are deemed as, like, what's normal or what's expected. But I love that, like, there is no normal, and it's really about the communication between you and your partner. And whatever you decide is pleasing for both of you, then that's plenty. I think that's sufficient.
Yeah, definitely.
What % of women can have orgasm with intercourse alone without clitoral stimulation?
I don't know that exact
I
statistic.
don't know that.
I don't know. I don't know that exact number either.
Pass.
Yeah.
How do you not fall into a boring sex routine?
Communication. And the other thing, suspending judgment and being able to talk with your partner, and also to not have judgment about what is arousing to you, I think is really important. And anything over time that becomes routinized is boring. And so it really is about what is stimulating, and being curious and not assuming that you know what your partner likes and doesn't like because they've always liked it or not liked it, and being willing to kind of be curious in a way almost like you are with the beginner's mind, where you start to ask questions like, how have things changed for you, and what do you really still like or not like.
And I think going back to what you're saying in a really non-judgmental way, so that you create a safe space for your partner and that you can get that back, where you can share in an intimate way without feeling like, oh my God, I don't know if I want to say that. So.
I think too, like, I think sex means different things to different people at different times.
Yep.
So in kind of planning this event, you know, we kind of wanted to set the mood and things like that. And so one of the questions I was asking some people is like, what are some of the foods that you consider sexual? And to me, I'm like, the traditional, like, strawberries with cream, chocolate, you know, but then someone that I spoke to, they were like, pigs in a blanket. And I'm like, what?
Or corn dogs. There was a corn dog.
I'm like, wait, what? But then when I kind of, because I'm very interested, I'm like, wait, but why did you say that? Like, what makes you identify sex with pigs in a blanket? And she was just like, well, to me, it's just very comforting. It's very like, I feel good and I feel comforted and I just am like snuggly and warm. And I'm like, oh, okay, I get that. And so I think that can like totally change, like at any minute, honestly. Because yeah, there are times I feel like, you know, if we're going through, you know, if we're just going through trauma, or just like there are different reasons, like sometimes sex does, or intimacy does just feel like comforting. I just need you to hold me. Or you like just cry because you just need to like release something. Or you're like super, like I'm just like want to take over and take charge. And so yeah, I think it just, there is no normal, it's an ebb and flow.
That's really interesting. Research also shows that when sex stops, it's usually because the man stops approaching. And often what I hear from men is, I really get tired of approaching. Or if I've been rejected enough, I just give up. I'm not going to keep approaching. And so I think that, I like what you just said about that.
I love my husband of 28 years, but I have had almost no sexual desire for several years. Now we are both having some physical issues. How do we keep intimacy?
This is another really interesting thing. If you're too close and you're blended or enmeshed, then there's no passion, there's no tension. And if you're too distant, then often people feel disconnected and don't want to have sex. And so something in the middle is what you're going for, and being able to, like, if one person is having a hard time, the other person needs to be able to have a self that's differentiated, does that make sense? And not, like, if somebody is in pain or suffering, the other person has to be in pain and suffering with them. And really what you want is a little bit of distance or tension so that you can move toward one another instead of when one person is caved, then the other person is also in the same state. Does that make sense?
Yeah,
That's very
definitely.
interesting.
So that's all the questions that I got for index cards, but if anyone has any questions they want to ask out loud or share anything, you're welcome to.
Yes.
Do you guys have any suggestions with confidence, body image, and improving your overall self-confidence? Like, I like how we talked about what made us feel sexy in the beginning, but Julieann, or do you guys have any tools that you help patients with body image and self-confidence?
I like to encourage people to find one thing that they like about themselves. One body part, it doesn't matter what it is, and start with that. And also, nobody is perfect, and so finding what you can love about yourself or what you can work with, and you go with that. And so if a person feels like, well, I really like my eyes, then they can work with that, and that becomes something they start with. Or maybe they feel good internally because they're strong, or maybe they like their feet, if it's body image stuff. I mean, really, it's whatever people can start with, and then really build on that, and also empowering people to not be so physically oriented. But it's really hard in our society.
Especially here in this part of the country.
Oh my gosh,
yeah.
yes. And even when, like, what the imagery that was on the TV and the movies that were playing, it's like fake book again, where it's a standard that isn't real, and everything is coordinated and choreographed, and it's the perfect scene and music and lighting, and this person is photoshopped and that person is, something else.
Filtered.
Yeah, exactly.
Yes.
And so then what we learn from a very early age is that's what we're going for. And if you don't have the perfect romantic scene, then it's not right. Or if love changes from the first stage of lust and it goes to attachment, and then the final one of commitment, and it doesn't feel as exciting as it did in the beginning, people feel like something is wrong with them, when in fact that's really normal and natural. So I don't know if that answered your question. Yes.
I'm asking for a friend.
Of course, yes.
So as the guys are getting older, they're having more difficulty reaching their orgasm, and so it's sort of, how would you recommend keeping that going? Like, it's harder for them, and I actually have one friend who broke up with a guy because it just wasn't happening at all. He could not keep his erection. But then I know that they have their own issues with aging, so we have ours, they have theirs. How does that all work out?
Well, I think younger men, the goal is ejaculation. And as men mature, that doesn't have to continue to be the same goal. And so, again, part of what you can do as a woman if you're in a relationship with an aging man is let them know that it's not about the ejaculation. And there's many ways to be sexual and to be intimate that don't require him to have an orgasm. And then, of course, there's other things.
Yeah, so I was going to address some of the medical issues. So just to generalize, men tend to be kind of notorious at avoiding medical visits and going to the doctor. And so what I've seen quite a bit throughout my years of practice, and I'm sure April has too, is you get these men that are working out, they're doing everything they can, they look great, they're like running marathons, but they've got like cholesterol through the roof, high blood pressure and diabetes, and they're a complete disaster inside. These are the guys that are like, that dropped out of a heart attack and everyone's like, I don't know what happened. They were in such great shape, but they've got all of these underlying medical issues that aren't immediately obvious. So I think step number one is to make sure those men are going to see their primary care physicians and getting a thorough medical workup, because a lot of that stuff can be addressed, by just looking at some of those possible underlying issues first, and then you can kind of go from there. What did you agree?
And then, of course, there's medicines we're all aware of. If
Yes.
they get medical clearance, they can help.
Yeah.
I love what you just said, because I didn't say that in the beginning. With sexual dysfunction, the first thing we do as therapists is try to rule out anything medical, because often it could be a medical thing, and if we're trying to treat it from a psychological standpoint, and it could be helped with medicine or through ruling other things out, that's really important.
Yeah, it's really simple. It's
Need
just
to work
blood
together.
tests and going to see your doctor and getting just the basic stuff taken care of.
Blood work.
Yeah.
A lot of the men I see too, especially in this area, are taking different supplements or hormones.
That's very tricky.
Yes.
And that can affect it too, right? They
Yes.
look really buff, but it's also they're really affected
Right.
by.
And interestingly, testosterone in excess actually drives up your cholesterol very high. And so they'll be going to see these special people that are prescribing this stuff, or getting into Mexico again.
Yeah, exactly.
And without any thought as to how it may affect, other underlying medical other underlying medical conditions that may already exist. So I think it's important to kind of look at everything as a whole.
And looking at the medication that people are currently on,
Right.
and what else they're doing, like with SSRIs or antidepressants, that can affect libido.
That's a good point.
And so
Too much alcohol.
and too much alcohol also.
Right.
Mm-hmm.
And some other cardiac medications can also affect erectile dysfunction
I was
as
going to
well.
ask you that too. I just feel like so many people are on antidepressants, and I feel like, or anti-anxiety medication, and I think a lot of men and women are on it. So like if there's two people in a relationship and they're both having libido issues, do you have any advice for somebody like that?
Well, if they're on the exact same page and they're happy about it, that's awesome.
Yeah.
But if it's not, then I think, again, talking to either your primary care physician or your psychiatrist, whoever who's prescribing those medications, there are options that affect libido differently, that can certainly be altered, and alternatives to look at that can help mitigate that problem. So it doesn't have to be, either you're depressed or your libido's good. So, yeah.
Jackie has a question. What I recall is that you said the M-cell works for women's orgasms.
Yes.
And what about men?
Thank you. Yes. So it is also effective for men for improving incontinence and erectile dysfunction, and improving orgasms and all that good stuff.
Because of the increased blood flow?
Exactly. Yes. Yeah.
I have a thought. So if a man hasn't had sex option for a while, since it's like a muscle, does the muscle need to get strong again?
That's a good question. I would guess it would depend on the man's age. How long is a while? Are they masturbating? Usually they're masturbating in between, so it's still all working. So, which is fine. It just depends.
That's a good question. It's interesting. All right, any more questions?
We've covered a lot.
Yeah.
This is really good.
I just have to say, I feel like because we have such a range in the room, I mean, we've got, anywhere from 20 to and up. So I think that there's
Very diplomatic.
I just feel like, if you're on the younger side, I feel like just hearing this at that age is very helpful. Because I think as women, we put a lot of pressure on ourselves and a lot of judgment on ourselves. But then I loved hearing how relationships change over time, and that's okay. And really, there is no normal. I actually don't really like that word personally, because I just think it doesn't define anything. But yeah, I mean, this evening was amazing, and I first want to just thank everyone for coming and being engaged and interested. Thank you for all of our experts and our testimonials, for sharing, because this is a topic I think that, it is very private and it's intimate, and I think often we don't even have these conversations with our best friends. It's sometimes easier in a group of people that we might not really know each other, or, you know, anonymously through cards. And so I just want to encourage everyone, you know, continue asking questions. You know, we have all of Julieann's information here. We're going to kind of like break and let everyone, you know, take everything in, refill your glass of wine, enjoy the space here. We also have everyone here available to you. So we have Jackie, who is also one of our medical providers as well. We have April. So all of myself, Dr. Nanos. If you have any questions about any of the procedures, you know, that we do here, we're here to answer those questions for you, and we can do that in private. You can just pull us aside, or we can even set something up for the future. But yeah, I just want to thank everyone for being here and for contributing. We are going to continue this conversation. So like I said, this is a series. And so I hope that everyone will participate and maybe encourage a friend or, you know, someone that they feel would benefit or just it would help in the future. We'll follow up and we'll send out those dates for you as well. But yeah, thank you.
Thank you. And we're also doing a podcast, Annie and I, about health and wellness. And Julieann is going to be on one of our podcasts, so we're going to extend the conversation a little bit more. So I'm excited for that.